Welcome, everyone, and thank you for joining us tonight. We have a very interesting session for you tonight featuring Dr. Yvette McQueen. And it's almost exhausting reading her bio. She's involved in so many interesting things. She's a global physician on a mission to educate about health, wellness, and disease prevention. So that's the overarching thing that she does. She's an emergency medicine and concierge travel physician, and she'll tell us a bit more about what that means. She's also a best-selling author, speaker, consultant, CPR and first aid instructor. She conducts wilderness emergency care training and international teaching for the American Heart Association. She has traveled for pleasure to more than 40 countries. So she's an avid traveler in addition to all of her work. She organizes medical missions to Africa, conducts hospital training and teaching in Rwanda and Tanzania, and participates in international church missions. She's also if some of you may have seen this, she's the executive producer on the award-winning PBS travel show Fly Brother. And she's a wellness lifestyle coach, a member of the board of directors of the Wellness Tourism Association, and hosts continuing medical education trips and retreats. So how she found time to join us here tonight, I do not know, but thank you so much for joining us, Yvette. It's so nice to have you.
It's a pleasure. I'm always here to give information.
Great. Well, then maybe we'll just dive right in to our questions. There are what are the most common and preventable medical issues that travelers run into?
The most common and the most preventable put together is dehydration. And because dehydration will lead to a lot of other things. People are traveling, they forget to drink, they get off their schedule. They're in, say, in the summertime, like now, they're in hot weather when they're not normally, so they don't keep up with their hydration because they're sweating. They're, celebrating, drinking a little. Alcohol will make you dehydrated. They eat some street food, they get diarrhea, they get dehydrated. So that is one of my number one tips. I have 3 top tips, and that's one of them is hydrate before you travel, during your travel, and after your travel, because it's going to prevent a lot of other things that come up from whether dehydration. It reduces jet lag, it reduces the risk of blood clots, it keeps your joints lubricated so you can still move and hike and do what you need to do.
Okay. Well, as it happens, I just happened to notice today on Twitter a post that you did where you were saying that you were hydrated and you had your compression socks on and you were ready for the plane to take off. And I hadn't really thought about the importance of hydrating before traveling. So I'll definitely keep that in mind for my next trip. What are some of the things that we should all be packing in our bags when we set off traveling that would health related things?
Okay, well, first of all, I see some people are from Canada, so things work pretty much the same thing, US and Canada. You definitely, all your medications should be in your carry-on. Please do not put your medications in your check bag, because as we know, we're seeing all the stories about Heathrow and Amsterdam and all these lost bags. Your medications will be lost. So you should need to have your medications with you, your prescription ones. And if you're traveling internationally, they need to be in their own bottle with your name on it. Don't put it in the little pill packs Monday, Tuesday, Wednesday, because when you come back through customs, you want to have your name on it in case they stop you and discuss what are these little pills that you have. Take other things that you normally, even if it's the over-counter vitamins, Tylenol, ibuprofen, because and when you go to other countries, they have different names for them, and you may not be able to equate with, like you want your Claritin, but they're using the generic name and you can't really explain what it is. That definitely that. Always take a little first aid kit I always tell people, just, Band-Aids, whatever you need to do. You should always take a mini flashlight. I take a mini flashlight. It's in my backpack everywhere I go, even when I go to work around the US, because you never know when lights going out. I mean, just today in Maryland, they had a storm and many people had lights out. So you could be in a hotel, the lights go out. It could be a fire alarm or a fire drill. And people have said 2 o'clock in the morning, they wake up, they got to go down some steps. The first thing you should be able to do is grab a mini flashlight. I tell people to take duct tape. Now that has nothing to
Mhm.
do with health, but a small roll of duct tape have saved me when my bag comes off the belt and is torn, or just anything. The wheel is torn. The other thing, duct tape helps to save you. And then other things, it depends on whether you're being adventurous or hiking or going to be outside. Like if you think you may get bug bites, you want to take, of course, your hydrocortisone, mosquito spray, things like that. So you adjust it according to your travel.
Okay. My mother will be very happy to hear that you recommend taking a small flashlight, because I think almost every year there's a tiny little flashlight in my Christmas stocking. I don't know. And I don't know that I even have, registered what I'm supposed to do with that, but that's
Just
actually
drop it in your
really
purse
smart.
and keep it. Just like your lipstick and compact. Just keep it in your purse. Never know.
Okay. All right. So people often think about, when they think about medical issues related to traveling, they think of emergencies or accidents and that sort of thing. But you also focus on, what it is to travel well and healthy. So could you maybe give us some tips for solo travelers to help us stay healthy and safe while we're on the road?
Sure. So, first of all, you should always plan and research. And if all of you travelers, I'm sure you do that, but especially during these COVID times, I'm just going to say it. Plan and research. Plan where you're going, of course, your destination, but find out what's going on in that destination. As the surges go up and down, activities changes, things close. We was talking about one of our favorite museums, and I had to figure out that you just can't walk into museums anymore. You actually have to make reservations, like a week to 2 weeks in advance, things like that. Find out if you do have a chronic illness. There are some people that travel and they have like kidney disease on dialysis, but find out what the medical facilities and the destination you're at. So I tell people that, going to an area you're going to actually put a taxing on, or you're using the medical facilities when they don't have a lot anyway. Um, it's selfish. And basically, you go in there, like a lot of small islands don't have everything that we have in the US or in Canada. So I've worked on some of the Caribbean islands and we have to ship people off a lot of times. So just research if you have a medical condition, just in case, or say if someone knows they're going to go bungee jumping or ATVing, what's the facility like? And what will I need if something should happen to those emergency? Of course, if you international travel, you should always have travel insurance with a medical rider on it, so that if you do need to be evacuated, put on a hospital or a plane to go back to your own country, you need that medical travel insurance. I told you about hydration, hydration, hydration. And then to stay healthy, sleep. People forget to sleep when they're on vacations. Oh my goodness, you're packing before. Oh, I'm gonna sleep on a plane. I'm gonna sleep on a train. Just you'll be next to a crying baby or someone that wants to talk. You won't be able to sleep. So try to get your sleep before. But every adult should be getting 7 to 8 hours of sleep. Your vacation is not. I know a lot of times we want to do 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 do. Have some downtime in the afternoon. Do an excursion or tour. Have some downtime. Make sure you get enough rest and sleep, because if you're getting enough sleep, you keep your immune system up. And if you keep your immune system up and you're rested, you're at less risk to get any of the viruses, because it's just not COVID, that's rolling around. And then other things to think about, when you're traveling, maybe you want to do like a bicycle or a walking tour versus a riding tour that helps you to keep active and moving and things like that to stay healthy.
Okay, that's great. Let's see. I think we have a question from someone here. Let me just find it. Yes. Okay.
It's a COVID question.
Oh, okay. Yes. Well, then let's just skip to that question.
Yeah.
So Jean says, flying across Canada in 10 days, visiting friends I haven't seen in years. Any advice around staying safe from COVID, masks in the house? We're all vaccinated.
Yes. Okay. So here we go. COVID is here to stay, people. It's not going anywhere. And we do need to get on with our lives, but you can do it safely. It's not like it was 2 years ago. 2 years ago, we didn't understand it. We didn't know the disease. We know it a lot better now. We know it's mostly airborne, not really contact a lot, but mostly airborne. Once again, research where you're going. So the city that you're going, wherever you're going, find out what their positivity rate is, because most of the positivity rate have been down. Now they're starting to elevate back up to the 20%. The new variant, if you're going to be in Canada, I'm not sure about Canada, but in the United States, the new variant is the Omicron BA.5, which they say is more highly contagious. So they're asking people to mask again indoors. Okay. So what I tell people, if you're unsure of the people you're going to be with, you don't know them, I'm going to mask. That's what I do. I mask. If I know them and I'm comfortable with them and they've tested and I've tested, which is not always a guarantee, I may feel comfortable more to relax it if it's a small setting, 4 or 5 people. But if I'm in a setting where I don't know people, I wear the mask. I wear it on a train. I wear it on a plane. And I just flew back from Amsterdam, which was an 8-hour flight. And yes, I did have my mask on for the full 8 hours. And if you want to drink something, a lot of people are like, oh, they take it off and drink. I'm like, raise it up and take a little sip. keep your nose. You got to think, where do they test? Most, you can't do saliva, but most of the tests in the nose. And so that's where your passage of COVID is actually infecting you more through your nasal passage. So I always try to keep the nose part covered. Anyway, when you're traveling, whether you're on a train, plane, rental car, these are things that I've been doing. So I travel around the United States and work in different ERs. I've been doing that for the last 14 years. And so just some of the things I was doing anyway, I still do. The only difference is I wear a mask. So I take my hand sanitizer. I try not to touch my face after I've touched other things. I take my wipes. So always hit the high contact areas, the seat rest, the buttons, the shades. If you're in a car, your steering wheel, the key fob. If you're in a hotel, don't forget the remote. A lot of people are like, oh, the telephone. Don't forget things like the remote and the light switches. And I know they say they clean. I just clean after them again, a little bit with my whether it's Lysol, Clorox wipes, whatever you want to. All of them works the same.
It's very interesting, speaking of hotel rooms, because I last month stayed in a hotel for the first time since 2019. And a lot of things had changed. And one of those things was that there were fewer things to touch. There were, they didn't have the all of the toiletries and all of the cotton balls and all of that sort of thing, but generally the room was more bare, which actually makes sense. Was surprising to me because had been years since I'd been in a hotel.
Well, they also stopped putting a lot of the toiletries out because they found it was not cost effective. So if you notice, a lot of the hotels now, instead of having small bottles of lotion and things like that, it's on the wall. Like your shampoo and conditioner and shower gel is attached to the wall in the shower instead of giving you little bottles. So that way they're not spending money on the little bottles, they're just refilling it. That's why you're not getting that much. So some of it's cost effective. Also, one of the new things in the hotels is that they don't come clean every day anymore. So it depends
Yes.
on the hotel, and they'll let you know we do not clean every day. If you want to renew towels, that's fine. Or you have to schedule your cleaning. So like when I'm at work, when I travel, I'm maybe in a hotel 5 or 6 days. I'll have to actually schedule my cleaning for the next day. Can I have my room cleaned tomorrow? And they put you on that list. So that's one of the new things the hotels are doing.
Right. Which is probably better for the environment as well, right? The
Mhm,
less
mhm.
plastic and fewer cleaning products, and or less laundry. And let's see. So there's another idea, is to put the hotel remote in a clear plastic bag.
And that's what they were doing during the pandemic. During the pandemic, we were still in it, because I stayed at a lot of Hiltons, and
Mhm.
that was the policy of the Hiltons. They've recently stopped that, but you would go in and see the remote actually, and they'll have it sealed, and it's been cleaned, and it's actually in a plastic bag.
Okay. All right. Well, I think my next question was going to be about COVID, but I think we've probably covered it, unless there's anything that you want to add for people about that. I feel like we've gotten a little bit lax,
Mhm.
because we've been, um, the feels like the big urgency and panic part has passed a bit, and many of us are vaccinated and that sort of thing. But it's just as you were saying, I was talking to my doctor today, and she said exactly as you did, that she wears the mask, and whenever she's around
Yeah.
strangers or on transit or that sort of thing. And that also in Canada, BA5 is now quite
Okay.
high. And so she was recommending, going back to some of those protocols that we might have started to abandon.
Yes, yes. Someone just asked in the chat too, is what if you test positive in another country? So it depends on what your country rules are. So as of June 12th, 2022, the United States dropped that you have to test to get back. I don't know about Canada, but if you test positive in another country, which I've had some friends do, they were in Spain last week, and the husband tested positive, the wife did not. They're like, oh, what should we do? I was like, sit your butt down for 5 days. That's what the CDC requirement is, 5 days of isolation. They're like, but we have to change our flight. That's why you have, once again, the travel insurance. And most of the travel insurance will have a COVID rider and let you know. And if you call them and say it's COVID related, they'll adjust that. And yes, you may have to spend more money for your lodging. But can they get on the plane and go? Yes. Will anybody stop them? No, because there's not testing to get in the country anymore. But it's all about your moral aptitude. Do you want to get on, know you positive and get on a plane with people? That's up to you. But I was like, sit down for 5 days because that's the CDC requirement.
Yeah. Yeah. And I wouldn't mind sitting down for 5 days, as it happens.
Have some room
Okay.
service. Yeah.
So I'll just encourage people. I have more questions still, but I'll just encourage people to type their questions into the chat, and we will get to them all. Um, so on your website, and also in a Forbes article recently, I saw you quoted talking about sort of telemedicine consultations for travelers, which I found very interesting. I knew nothing about this. And I wonder if you could tell us a bit about that, and whether it's something that's covered by travel insurance companies, or if it's something people purchase in addition to their insurance, and sort of how that all works.
Okay, sure. So, my business as a travel concierge physician is my concierge business is a cash-based business. I will tell you that, and most of it's word of mouth because I really haven't advertised about it. But even prior to the pandemic, what I would do is say someone wants to go to, Liberia, Africa. They would contact me and say, what vaccines do I need? What should I pack to go there? If they do have medical conditions, what's their medical situation there if I should get sick? I would research if they should get sick, well, like if they need to go to English speaking hospital or if they need to be evacuated. They could always reach me via if they had Wi-Fi by telemedicine and say, I think I ate something wrong, a stomach ache, what type of medicine I should get, or if they didn't bring like the anti-nausea medicine or anti-vomiting medicine. That's what my business is. Of course, during the pandemic, it changed to more as people were traveling and being positive in other countries. I would, tell them, what to do, what medicines to take, if they needed to go find the nearest hospital they need to go to. If they need to come back to the United States, I would write them a recovery letter after they've been isolated for 5 days and no symptoms. So that's what I do as far as my travel concierge. Now, some insurance companies, more insurance companies are increasing their telemedicine capacity. And I know, like I think Aetna, Cigna, things like that have told if you're using their insurance, that to call this number first, and they use a lot of telemedicine there's a lot of different companies out there, to call and talk to a telemedicine provider first to find out what you should do as far as whether you should go to ER or send you to a hospital or a local doctor where you're traveling. Now on the bandwagon, and this is where you read in Forbes, the travel insurances are getting on board with that now with telemedicine. So I know Alliance, and I forgot the other insurance company, they actually do have a telemedicine component to their travel insurance. So when you do get sick while you're traveling and you have their insurance, they will hook you up. Especially, I know that with the US, they'll say, we'll let you talk to a US based doctor because people feel more comfortable with doctors in their own country. But they also do the same thing. Okay, I'm looking at you, you can get by and you probably can take this medicine, or this is the hospital you should go to in that city.
It sounds like a great idea because one of the things about getting sick when you're away is the panic of not knowing
Mhm,
how the healthcare system works
mhm.
or how to access help. So the idea that you could access someone who speaks the same language as you and understands, knows the context of your healthcare system must be really comforting when you're in that
Yes.
panic.
Yes, or, when I talked to, I talked to a couple of agents and they had, or travel advisors, as they now call them. They had a client in Morocco and they were like, he's sick, he needs to get home. What should I do? And I would point him in the direction of how to, evacuate out.
Okay.
Mhm.
Well, we have a couple of questions popping up here now. Ruth is asking if there's something you would recommend for seasickness prevention now that the behind the ear patch is not available.
Oh, it's not. Where are you at? And Roof is in the
I
in
think Ruth is
Canada?
in Canada, I think. Yeah.
Oh, it's not. Well, it's still available here. That's interesting. So the alternative would be Dramamine that you can get at most um, drugstores,
Mhm.
pharmacies, over the counter Dramamine. Some people use those bands. I haven't found them effective. Those wristbands for seasickness. I haven't found them effective. Ginger is very good for any seasickness, motion sickness. You can get ginger chews or ginger candy. If you can't find them, get them off of Amazon. And I tell pregnant women to take them. So you can do it and suck on it, and that will help you with seasickness. Ginger is very good for it and for nausea if you get nauseated for any reason.
Okay. And Tim is asking if you recommend anti-malaria pills or are using good practices like insect repellent and nets and clothing. Is that enough when you're visiting places like the Amazon? And I feel like I said something funny and I don't even know what it is.
Oh, yes. So I'm in a lot of travel groups, and it's so funny when I'm laughing because I watch these questions come up, and I believe in naturopath. I do. I have a lot of friends that are naturopathic physicians. and natural way, and it's an additive. Yes, Amazon, Africa, any of the equator belt where malaria is high, you need to prevent. So the first they say prevention is the insect repellent. And if you're an adult, you can actually have DEET, make sure it's 25% DEET and above. Children, they can't use DEET, but there's other alternative. Skin So Soft, that Skin So Soft, Avon still works. It works. They have
It
a white,
does.
yes, in the spray, it does work. I was in Belize and I had that and I was the only one that didn't get eaten up.
Okay.
But so yes, with that, of course, when those areas, people think it's hot, but covering yourself dawn and dusk, that also helps. And I also, a lot of times when I'm in Africa, I spray the clothes too. Okay, now when it comes to anti-malaria medicine, yes, I suggest it, I prescribe it, and I highly recommend it. Only because, you know what, you can do all that and still get bitten anywhere by a mosquito and you don't know what it's carrying. And if it's carrying malaria, you don't want malaria. You are sick. Malaria, I mean, you'll get the high fever and sick, and then you'll be good. You'll be normal for a week, and then you'll be sick again. Or sometimes malaria doesn't show up for 9 to 12 months. It can lay dormant in your cells that long. And then 12 months later, you're like sick, high fevers, shivering. And if you are not having that immediately traveled, that's something you forget to tell your doctor. Someone goes to the hospital and they say, I'm sick, or they go into urgent care and they're like, I'm sick. And one of the questions I always say, have you traveled recently? Well, someone's like, no, I haven't traveled for a year. And then you don't think that can actually be it. So I would just say it's better to take the medicine than to actually have malaria later on, because it can be a long-term sickness. Now, there's 3 different types of medicine that you can take for malaria, and it's not made for everybody. So it's one, of course, what's that? Mefloquine. Mefloquine is the one that gives you crazy dreams. Crazy dreams. People that are already on anti-psych medicine should not take it. Then there's Melarone that most people will take. And then there's doxycycline, which is like an antibiotic, but you actually end up taking it longer. So a lot of people go with the middle one because you can take it 2 days before you travel and then 7 days after you come back. Doxycycline, you have to take it 4 weeks after you come back.
Okay. Well, that answers that.
Can I pop in for a second and ask, what about Hep C? And I don't know if Hep B is a risk or not, but Hep C I keep on hearing about in relation to beaches and things like that.
Okay, so when it comes to the hepatitis diseases affect your liver. So the hepatitis A is related to eating food and water. So you get that a lot. So one of the great things we say, if especially with fruits, if you can't peel it, don't eat it. If you can't boil it, don't eat it. Don't eat the lettuce, don't eat the ice, or don't drink the ice. Sometimes you got to drink warm drinks. So hepatitis A deals with water and eating. Hepatitis B is bloodborne. It deals with the blood. So most of us has hepatitis B series. I know anybody that's 30 and under, they now give it to all children. So hepatitis B is dealing with blood. Hepatitis C deals with sex. That's how it's transmitted. So yes, they do talk about it at the beaches. Are they exchanging sex? So yes, hepatitis C is transmitted by sex. Hepatitis D is also like hepatitis A. You don't see that a lot with water and food.
And is there prevention that you take for that?
No.
No. Okay.
Safe sex, condoms. Know your partner.
There was one thing that came to mind when you were talking about what to pack. And I have taken, and this is maybe a sign of age, but a small magnifying glass, because sometimes what is written on these medicine bottles or
Oh.
whatever. It's so small that and because it may be in a different language and
Yes.
the scientific terms or whatever are pretty universal. It's really important to be able to know the difference between a T and an L and things like that. So I've taken to carrying a magnifying glass.
That's really clever. I feel like these days I need one in the shower so that I don't condition my hair before I wash it.
Can't get the anti-fog glasses.
At least it warns you not to drink it.
Yes. So you've traveled a lot and worked in healthcare in many different places. And I'm not sure, are you only able to practice in the US, or do you also practice in other countries?
So with the United States and doctors, you actually have to have a license in the state that you're practicing in. So
Ah.
I currently have 7 state license, and I do what they call locum tenens, or substitute doctor, where say if they need a doctor in Missouri, I go there, work 5 or 6 days, and then fly home, take a week off and fly back there again, or fly somewhere else. So I work in the states that I have license in. Also, when it comes to telemedicine, I I can talk to patients that live in that state and do prescribe them medicine, but also if they're traveling. So I have a Florida license because I lived in Florida for years. And there's a lot of people that visit Disney World and things like that, and they get sick while they're on vacation. I can actually prescribe medicine and do telemedicine with them as long as they're in that state that I have a license in. Okay.
Ah,
So
okay.
that's how the United States work. I cannot practice in Canada because I don't have a Canadian license. I do have a license in Malawi, East Africa, because that's where my church has done medical missions for the last 20 years. So I do have that as far as treating patients. When it comes to the Caribbean islands or some of the other places, they'll take the US license and give you a temporary license while you're there, or they'll give you a courtesy license. So I'll call, like when we took a group of 70 people to Egypt, and I called them ahead of time. I called like the main hospital, the university hospital. It's like, hey, I'm coming there with 70 Americans, and I'm the team doctor or the trip doctor. And I had a courtesy license to actually be able to take care of my group. Couldn't take care of any Egyptians, but I could take care of my group while I was there. So there's ways of different work that are around it.
Yeah, that's really that's interesting. Do you do a lot of that traveling with groups where you're the doctor for the group?
I was prior to the
Yeah.
pandemic. uh,
Yeah,
this
I guess
changed a lot.
everybody has that qualifier now, don't we?
Right, I was. So as people are restarting again, um, I'm actually taking my own groups now. I've now started um, traveling, and it's mostly with other physicians because, like you said, I provide continuing medical education trips. That's why I was in Amsterdam. I'm taking a group to Greece. And I haven't gone back on any mission trips as of yet. So as things start up again, we'll see how that goes.
Okay. Now, I happen to notice on your website uh, something about medical tourism. And that's something we've never really covered, but I hear a lot of people talking about it. Could you tell us a little bit about that and maybe what kinds of things people should consider if they're looking into it?
Sure. So medical tourism is a night lecture all by itself.
Ah,
But
okay.
I will briefly tell you that people have, and as Canadians, you may know you have your socialized medicine. Here in the United States, most medicine is piecemealed, insurance, and it's very, very expensive. So a lot of people in the United States had started to choose to have procedures somewhere else. And that's what they end up calling medical tourism, because they could travel somewhere else, be put up in house or hotel, have their procedure, stay the allotted amount of time, and then travel back home, which can be great and not expensive, or it could be cumbersome and actually dangerous if people don't research where they're going. So, and countries have really started to push that. Turkey is one of them. Turkey has an excellent medical system. A lot of, and I'm just saying, there's excellent medical systems around the world people don't realize. Turkey has an excellent one. So they started to push like, hey, we could do a hip surgery, a hip replacement for $10,000. Versus the United States, after your insurance, you may end up paying $90,000 out the pocket for that after your insurance, believe it or not. So, I mean, you know, in the DR, a lot of people go down for their plastic surgery, their breast, you know, reductions, their liposuctions. A lot of people go there. They go to Mexico. I know a lot of people go to Colombia for dental procedures instead of having, you know, getting a crown for, you know, $5,000. They can go there for $500 to Colombia and get that done. Thailand has an excellent medical system. I know a lot of executives actually go there, go to their hospital, have what they call the executive treatment, where they start you at the door and does everything from your ultrasound, EKG, and your yearly exam for minimal cost. So that's what medical tourism is. But the only thing I do say, people, is research. You have to research, because just because one person did well with another one doctor, you got to know what their track record is, because I've seen some horror stories. I've seen people come back to the United States septic and sick because they're not using sanitary procedures.
Yeah. We have often comes up in on our Facebook group when we're talking about travel insurance, that people from countries where healthcare is very expensive, like the US, they'd say, well, I'm not going to get travel insurance because healthcare in the country I'm going to visit is much cheaper than it is for me at home anyway. And it scares me when people say that, because that would make me so nervous.
It may be cheaper, but they don't know what's going to happen. Okay, typical example, I had a friend, she went to Zambia. She was whitewater rafting, broke her leg like 3 places, and they sent her to South Africa. So she got sent to South Africa, which, yes, it was cheaper, but her travel insurance, actually, she had to stay there 6 weeks before she could travel again. So her travel insurance covered that 6 weeks after her surgery. They covered, you know, her getting on a specialized plane that she can extend her leg to come back, versus otherwise she would have been out of the pocket for her 6 weeks and had to cover it for it. So the procedure was less, but what else are you having to deal with?
Right.
And I'm always amused whenever I, like in movies and TV shows, whenever you're on a plane and something happens, and you've always asked, is there a doctor on board? So I'm very curious. And that actually happened to my brother-in-law recently. And he's a neurosurgeon. Someone had a heart attack. And, you know, they're like, is there a doctor aboard? He's like, oh, no, I don't really know what to do. But thank God there was a cardiologist sitting right in front of him. So he got saved from that. So I'm curious. You must have had some of those situations, and I'm curious whether, you know, you could share some of your more interesting, is there a doctor on board scenarios with us.
I've had some interesting ones. They say, ding, is there a doctor on board? And most of us doctors just sit there for a minute to see if someone else is going to answer. Be honest with you. Being an emergency physician, which means I can handle anything. Unfortunately, sometimes there's ones that, yes, we were across the ocean. It always happens when you're across the ocean, never when you can land easily. We're across the ocean. You got a ding, there's a doctor on board. I sat there a minute, I looked back. So it's like, okay, let me get up and go. I went to the back, and it was someone having trouble breathing, and they're like, oh, we got a doctor already. I was like, okay, good, bye. And the doctor stopped and said, don't wait. I was like, what? He's like, I'm a dermatologist. I'm like, yeah, what made you get up? Really? You're a dermatologist, really? And the more you get into your specialty, you forget like the normal stuff. So airplanes do have the capability. Most of them have to go by the FAA. They're supposed to have a certain medical kit, and they all supposed to have the same thing. Some of them are lacking. I've seen of them. They all have a medical control though. So the pilot will radio whatever hospital they're connected to down on the ground and say, we have someone this and that. And either someone said they had a doctor, they had a nurse, or they had an EMT, or we have nobody. Should we divert or should we land? So that's usually up to them to make that decision, is their medical control. But I've had it, and you know, I don't know, a few years ago, there was incidents of people, you know, some airlines saying, well, are you really a doctor? Show me your license. We don't walk around with our license, especially if we're on vacation. You know, I travel for work, so sometimes I do have my badges with me. But you know, they're like, are you really a doctor? And I've gotten to the point, like, if you gotta ask me if I'm really a doctor, I'm gonna go sit down, because you know, most people won't just stand up and say, let me help the sick person.
Or you say, give me a moment to run into the washroom, I'll change in my scrubs and my stethoscope and run back out.
But I also, once again, am an emergency physician. I had that tune on though, because I'll see someone get up and I'll see them go to the bathroom. And sometimes I flagged the flight attendant. I was like, you need to check on that person because they didn't look good. And they've passed out. And so I could see when people are about to get sick. I mean, so I sometimes warn the flight attendants.
I hope you're on my next plane.
You don't want to get sick on a plane.
Tell us a bit about, you have written more than one book, but tell us a bit about Travel 911.
Sure. So Travel 911, my first book, I will tell you, it's called Travelpedia, and it has a little bit of how to stay healthy and safe in there, but it starts more like how to start from a couch dweller to become an adventurer and TSA and all that stuff. When it came to Travel 911, I really wanted people to take this and say, I can take this on my trip. This is going to be my guide if something should get sick, or to prevent. So it has chapters in there like jet lag, how to prevent it, what you should do ahead of time, what it feels like, and this is how to help it. I have the first aid thing where if you're hiking and you know, twist your ankle and you don't have cell service, what you should do, you know, get some magazines or a scarf or something to tie up your ankle so that you can move on. A little bit of the wilderness medicine. So it has different things like that to prevent medical disorders while you're traveling. You know, high altitude sickness. How many people have gone to Peru and gotten sick and they're sucking on the cocoa leaves? Or, you know, are you out diving? You know, stings from jellyfish. So it has the different, so it's not a book where you take it and read through it from chapter to chapter. It's like, oh, I remember she said that and this is happening. Let me turn to this chapter. So.
Well, that sounds like a handy thing to have in your bag.
Right, I call it a doc in your pocket.
That's very good. So we're starting to run out of time. So if anybody has any questions, please type them in the chat.
I have one final one while people are gathering thoughts. Something I realized I started doing when I was traveling, and this sort of when I was younger, is I would actually go and ask pharmacists or seek out pharmacists for medical attention, or not medical attention, not emergency, but I would go to consult them. And I found it was just handy because there's so many pharmacies, or there's so much more of them. And also they don't charge you to consult them. And oftentimes they'll be able to give you something over the counter. Is that a good approach that I took? And I find usually if it is something serious, they'll tell you, no, you need to go see someone else or get off my shop.
Actually, in other countries, that's what they tell you to do. United States is the only one that doesn't do that. Really, the United States is the only one where there's a competition between pharmacists and doctors. Because I remember being in France and I, you know, got a little cold, had a cough, and I just wanted some cough medicine, some Robitussin. And they're like, you have to talk to the pharmacist first. So most countries do that, where they do go, you go talk to the pharmacist, I have this problem, and they'll say, oh yeah, just take this, or no, go around the corner into that doctor.
And in some countries, I'm surprised how much power the pharmacist has to dispense medication. Because when I was in the UK, they were giving me some stuff that, I mean, I'm looking at the ingredients, and I'm like, I'm quite positive in Canada I need a prescription for this. But thank you very much.
Mhm. Oh yeah, Mexico, UK, a lot of the countries and things that we prescribe, you can just get. Yes.
Okay. So you have traveled to more than 40 countries. What is your next destination? What's on the horizon for you?
What's on the horizon for me? Like I said, I just got back.
Yes.
I just got back from Amsterdam. Let's see. I usually do, Paris is one of my favorite places to go. I will say that. So, and September is one of the best times to go. Not only is the weather great, it's great walkable, it's also what they call the shoulder season where it's least expensive. So
Right.
probably my next destination in September will be France. And then I'm taking a group of doctors to Egypt in December to do a history of medicine tour.
Oh, that's interesting.
Mhm.
And so these continuing medical education tours, are they related to the country you go to, or is the country a backdrop for the educational part?
A little bit of both. Like with the Egypt one, I definitely wanted to do the history of medicine because, hey, father of medicine, essential oils, things like that. And it's not just physicians. I mean, they take their spouses and other people. They just have to listen to. I usually talk around dinner time, so it's not like interrupting their tours. Sometimes, you know, I did a wellness and stress relaxation retreat for physicians, and we just chose an island. So we just said, "Oh, we're going to this wellness resort on this island," but we just knew we was going to go somewhere. We didn't have to do anything. Um, a
Nice.
little bit of both.
Yeah. Um, could you tell us a little bit about what in your bio, I had read that you were a wellness lifestyle coach. What does that mean exactly, and what do you do?
Well, that's like an extension of the concierge where I
Okay.
started. It actually started in my church. I was giving wellness classes where I would take a group of women and we would meet weekly for 6 to 8 weeks. And we would individualize, but as a group together, talk about how we could change our life. Because people like, oh, well, I have diabetes, I have hypertension, I have to go on a diet. No, you need to change your life. So that's what lifestyle modifications is a lot of times the prescription for you becoming well. So, but people always just think health, but the wellness is your total body. It's going to be your mind, it's going to be mental, it's going to be spiritual, it's going to be social, it's going to be financial. So that's why I said a wellness lifestyle, because you just is changing your lifestyle so that you can be well. And it's encompassing all aspects of your life.
Great. So I'm just checking to see if anybody has any last minute questions.
If no one else, for
Mhm.
me, I have a quick question. Just because, I mean, in Canada here, they're starting to open up the availability of booster shots for the COVID. And since we sort of touched on COVID earlier, I was just curious, from what you've seen, how how in like how what kind of sort of interval should you be going for, like in between booster shots? Like, should 6 months or a year, 3 months, a day? What have you seen sort of consistent data in terms of how often you should be getting your booster shots should you decide that you might want them?
So basically, the booster shots after you've had your first two, they've said it was the third one that came around and said, if you haven't had one 6 months, you should have it. If you haven't had a shot in 2022, you need to have one, because this variant is coming fast and furious. They say every 4 to 6 months, and it depends on your illness. You know, they say over 50, this, whatever. You have to check the newest guidelines or whatever the CDC is saying. But if you haven't had one in 2022, you should have it. They feel that the immunity runs out like 6 to 9 months. That's where it's going. Like if you actually had COVID, you actually have to wait 90 days because you're considered immune. You do have immunity for 90 days if you actually had COVID, believe it or not. But after 90 days, you can have the booster. So somewhere between the 6 to 9 months is the sweet spot where they're saying that your immunity is wearing off. Did that answer your question?
Yes, yeah, completely. Thank you.
Nancy just reminded me of something I'd forgotten, which is near the beginning of our chat, you mentioned that you had 3 top tips, and the first one was hydration. And she's asking, did we get the other?
Yes.
The others?
Yes. Okay, so hydration before, during, and after. Normal hydration for a person should be half of your body weight. So I'm gonna give it to you in ounces because that's what we do in the United States. So if I weigh 200 pounds, I should be drinking 100 ounces of water per day. So half of your body weight, okay? And you know you're dehydrated. Everybody think it's thirst. It's not. You know you're dehydrated by the color of your urine. So if your pee is dark and yellow and it has an odor to it, you need to hydrate more. You can also check by your hand. If you pinch up your hand and it pops back easily, you're hydrated. If it still tense up, you probably need some more water. 2, plan and research. I said plan and research. Look where you're going, what's going on at that destination, what's suitable, what's their positivity level. Are they having surge? If they're having a surge and you're more susceptible, maybe you need to consider reconsider your trip at that time. And then 3, sleep. Get your sleep because it's going to keep your immune system up, going to keep you be able to fight those disease, and you're just going to have the energy to enjoy your trip.
Great. Thank you so much. This has been such an interesting chat, and you've given us so much information in an hour. It's amazing. Thank you so much.
You're welcome.
Okay, I am.
And I'm just gonna throw it out there because you kept saying my website. If anybody want, my name is Yvette McQueen, MD. You can see it up there. I keep things simple. My website is YvetteMcQueenMD.com.
And we will send out a copy of the video to everyone, and it will include a link to Yvette's website so that you don't, in case you're not writing it down right now.
Yeah.
Thank you again.